so now I'm going to talk about the joints and the movements of the foot. So at the talocrural joint, the articulation between the distal tibia and the talus, you have dorsiflexion and plantar flexion. So dorsiflexion is the foot being pulled superiorly, sort of from the anterior surface or the dorsum of the foot. Plantar flexion is the foot being pulled inferiorly or posteriorly down. Okay, so plantar flexion or dorsiflexion is going to be up, plantar flexion is down. Okay, and that's either the talus moving on the tibia, and this would be open chained, so moving your foot up and down, or having your foot planted and moving the tibia either anterior or posterior. So that's closed chain dorsiflexion. Closed chain dorsiflexion coming forward like this, closed chain plantar flexion coming down like this. Open chain dorsiflexion, closed chain plantar flexion. And that's the talocrural joint. That is the only movement available at the talocrural joint. It has 1 degree of freedom. That's it. So it's mainly known for dorsiflexion and plantar flexion. The subtalar joint, this articulation between the talus and the calcaneus, actually has all 3 movements of the ankle that are available. So it has dorsiflexion and plantar flexion to a small degree. It has inversion and eversion and ab and adduction. Inversion and eversion can be thought as kind of a rotation and an open chain movement for the subtalar joint. That would be the calcaneus, kind of moving back and forth. In the frontal plane, you can imagine the axis kind of coming through here, an anterior posterior axis. Eversion can be described as the sole of the foot moving away from the body. That's eversion. And then inversion can be described as the sole of the foot moving towards the body. That's inversion. Okay, and that's the primary movement at the subtalar joint. There's also ab and adduction. Ab and adduction at the ankle is in the transverse plane because the ankle is orientated differently. So ab and adduction would basically just be the calcaneus kind of moving either towards the midline or away from the midline. Okay, so that's going to be ab and adduction. Adduction towards the midline, adduction away from the midline, but in the transverse plane. Whereas eversion and inversion is more of a rotary movement, okay, moving either towards or away from the body in the frontal plane. Ab and adduction is a very small movement and it's not measured very often. At the transverse tarsal joint, and that was the articulation between the talus and the navicular and the calcaneus and the cuboid, all 3 movements are available: plantar flexion, dorsiflexion, inversion, eversion, ab and adduction to the same amount. Okay, so the subtalar joint, it's mostly inversion and eversion. Although you have a little bit of ab and adduction, you have some dorsiflexion and plantar flexion. At the talocrural joint, it's all dorsiflexion and plantar flexion. The transverse tarsal joint has all 3 motions available: plantar flexion, dorsiflexion, inversion, eversion, ab and adduction. And really it allows for those movements to be expressed through the foot and allows for your foot to have a lot of flexibility and mobility on different surfaces. And those are the movements and the joints of the foot.